go ahead and turn it over to Peter Margolis, who's our Executive Scientific Director in Improve Care Now. And he's going to provide a little bit of the context for how we work together, how we've gotten to where we are, to provide some context for the speakers that will come a bit later.
Hi, everyone. I'm excited to get to talk a little bit about the network and kind of give you an overview. Can you go on to the next slide? So we always start off talking about Improve Care Now with our mission statement, and it's here on the slide. Our mission is to transform the health care and costs for all children and adolescents with Crohn's disease and ulcerative colitis. And our goal has been to create what we think of as a collaborative network that enables patients and families and clinicians and researchers, really everyone in the healthcare system, to work together to accelerate innovation, discovery, and the application of new knowledge. And if you go to the next slide, the foundational piece of, if you can go on to, and the slides may be...
Do you have a delay, Peter?
Yeah, there is a little bit of a delay. There you go. Thank you. I have also a little bit of a slow internet connection. So Improve Care Now started out with a focus on improving outcomes. That's really what we believe distinguishes the network and is really the foundation for the success that's been achieved. There's a shared commitment in the network to really making a difference in outcomes that matter for patients. So if you go to the next slide, one of the ways that we organize our work is that we're organized around how we work at the clinical level to achieve improvements. And this is what we call a key driver diagram. It relates the outcome that we're trying to achieve, that's on the left side of the slide, to what we call drivers, the kinds of things, the kinds of changes that need to take place in care to achieve the outcome. Things like optimal communication, proactive and reliable care, getting an accurate diagnosis and selecting the appropriate drugs, making sure that nutritional intake is optimal, and optimizing people's ability to really live with the disease. And every care center in the network is working on a variety of interventions and changes, trying to make improvements in all these different areas, and measuring their success with the impact on the outcome. And if you go to the next slide, the drivers are illustrated in a little more detail. And I may have a lag, so can you just tell me whether you're already projecting the next slide?
Yeah, so we have it's the key drivers of excellent IBD care listed up.
Great. Okay, so that's what I just talked about. These are the drivers of really achieving great outcomes. And the next slide shows some examples of the way work in the network is taking place really on a daily basis. There's focus, some care centers are focusing on things like planning for patients' visits, making sure that there's a focus on teaching and supporting the self-management or the things that families can do for themselves to optimize care. There are other things that, other ways of doing that, like creating support groups or incorporating patient education resources, using technology in the clinic, or even just making sure that patients come in at the appropriate visit. Have they been seen within the last 4 months? Go on to the next slide. Our Improve Care Now is a distributed network. We now have 96 teams across the United States, England, and Qatar, and almost 30,000 patients in the database. There's a very diversified communication program And this is necessary because one of the things that we've learned over and over is that different people like to get different information in different ways. And so our commitment is to meet people where they are, whether you're on Facebook or whether you like to read an e-newsletter or whether you like to read our posts. Staying up to date on what's going on is really important to us. And the goal is really not only that we're communicating what's going on, but you're communicating with each other and with us, so we know we can learn in a real-time way. If you go to the next slide, that means that everybody, that we're really after flattening out and equalizing in many ways the relationships between patients and clinicians, so that everyone can participate in making improvements, not only in your own care, but in designing the way the system works overall. Just go to the next slide. This is a slide that we like to show a lot. This was Improved Care Now in 2007, if you get a hold of the slides, the test afterwards is to pick out Sarah Myers in this slide. But this is the where we started. There were 27 of us who got together in the original meeting in San Francisco. And then if you go to the next slide, Improved Care Now really has grown into a vibrant community with lots and lots of people participating in many, many different ways across the country. And one of the most exciting things for us now is that there are contributions coming from every care center, from groups of parents, from groups of clinicians, from dietitians, from social workers, and contributions made really without people being asked. These are spontaneous contributions that take place in response to problems that arise. If you go to the next slide. So we're excited that the network has really become a community where we tell stories, where we're made up of smaller groups of people with common interests, where there's learning together and where there's celebration. And one of the unique and funny aspects of Improved Care Now is that every time we get together for a face-to-face community conference, we end together by singing Happy Trails. Dr. Coletti really loves to sing, and so it's one of the kind of funny and fun moments that takes place every year. And I don't know whether we're doing that at the end of the community conference, but perhaps we'll play it for everyone. So just go on to the next slide. So the goal again is to get more kids being healthy, more kids in remission, and really being able to live their lives gracefully with this disease. Go to the next slide. We measure our success in a variety of different ways. I just want to show a couple of the metrics. Go to the next slide. This is one of the most important outcomes that we track. It's the percentage of patients in clinical remission across the network. And as you can see, when we started in 2007, we were at about 60%, and today we've gotten over 80% of patients in remission at their most recent visit. We're also having an impact on at the care center level, and so the next slide shows the percentage of care centers that have hit this target. And as you can see, it took actually, for the first 2 years, we were at 0. There were no care centers that had 80% of their patients in remission. Between 2008 and 2013, a 5-year period, we were at about 18%. And then it's really only been just since February that we've gotten over 50%. So this is a hard outcome to move. It's a challenging change to achieve, and our goal is we're never satisfied with where we are. We always see rooms for improvement, and our goal is to get every care center to this level.